Organization that has almost 700 units of housing, many of whom are people with significantly compromised health, and challenges to follow these protocols around, or these requirements to do 2-meter social distancing. We have a group of people that are really at risk of transmission, of community transmission between each other. And obviously, because of their compromised health, they are very susceptible of being sick. We also have 230 odd employees, and during this time, we've obviously recognized that what we're providing is an essential service. We've been informed by BC Housing, Interior Health, Community Living British Columbia, who are our primary funders of all the programs in housing that we provide, that we're considered an essential service. The absolute terrible dilemma that we faced as a leadership structure is our inability to access adequate personal protective equipment. The need for face shields is absolutely is essential for us to be able to operate. We've, by hook or by crook, we found hand sanitizer from a distiller in a community in the area. We found access to gloves, which has been thankful for us to be able to continue. Masks, to the point that I was just on the phone today and was speaking with a textiles fabricator in the Lower Mainland, who's got his equipment spooled up, and we've got 5,000 that we're picking up tomorrow afternoon. The face shields, there has been no access to this until we were contacted on Friday by Scorpion Industries, and I'm telling you, their face shields are by far the best device that we have seen.
Care aides and nurses are really on the front line, and so whether we have a COVID patient or not, we want to protect our staff. And as we know, this virus is through aerosol, and so really the best way to protect our staff is by covering their faces or giving care, and you could say they get up close and personal as they're caring for someone or holding a hand as somebody is passing. And so it's really important. The priority is to keep our patients and our staff safe. What I feel is the face shields, having that available helps bring their anxiety down, to know that they can go home safe every night to their families.
I'm Kathy Jardine, and I am the Director for High Country Healthcare's Clients and Staff Services. High Country goes into people's homes and they provide the support to them so that they can maintain as much independence as possible, so that they can continue to live in their home environment. That's really important for people, especially our aging people in Kamloops. They want to stay in their own homes, so we go out and do whatever we can to support them to continue to live independently. We needed face shields, obviously, with COVID-19 presenting a lot of challenges for people. It came on very quickly. All of the supplies, masks and such items that they're required to keep themselves safe were in short supply. We're having difficulty still trying to get everything that our workers need to stay safe. They need to stay safe so that they can continue to go into people's homes and help them. So the face shields, that they love them. They're absolutely amazing. They completely cover the whole face. They keep the eyes covered, the mouth and the nose. We still wear a mask underneath, just a surgical mask, but the eyes are really important because if anything gets in the eye, of course that's a way for the virus to enter the body. So because it's all happened so quickly, workers were very concerned for their safety, as well as families were concerned for their loved ones. So the face shield supports both the family and the worker in keeping each other safe. I'd really like to thank Scorpion Technologies. We, from the bottom of our heart, for our workers to go out there and be safe, that was a real struggle and a challenge, and they stepped up, they helped. We are all so grateful for keeping everybody safe and very much appreciated.
The core product that Scorpion manufactures is shipped across Canada, US, New Zealand, other countries. But we do, as a local business, we do as much as we can for the community. And because we have the capacity and the equipment, we just felt strongly that, it was the right thing to do. Our boss is amazing. When we brought this idea to him, he said, yeah, phone the supplier, make it happen. I think a typical face shield would be anywhere from $20 to $30. These masks are being strictly donated. Honestly, we started doing this because there was such a need for them. And protecting people who are protecting us is really probably the most important thing. My name's Ramsey. I'm the IT manager at Scorpion Technologies. There's not a lot of companies that do what we do. We manufacture industrial controls for hydraulic machinery. So basically upscaled versions of, joysticks and game pads that you would use for video games. We make those for large equipment like excavators, forestry equipment, mining, agriculture, things like that. We've spaced out our manufacturing, taking advantage of the space we have, and 6 feet distance and things like that. But we are still running in a smaller capacity. It actually started from a request from a friend of mine who's a nurse. I 3D printed one and gave her a couple, and we started looking at it. But the problem with 3D printing is it's really good, but it's not super fast. Realistically, we could print about 7 a day, right? Which doesn't really scale. And also there's the concern that if somebody coughs directly at you, or getting things in your face, that an actual full face shield was more ideal. But we also have a laser cutter and thinner material, which is effectively what we were doing with the 3D printer anyway. So we took that same design that was just a shield specifically just for the N95, and we adapted it for laser cutting. And then we were able to make one of those per minute instead of one of those per hour. It's a shield, not a mask, so it's not doing any filtration. You're still using an N95 underneath it. What we're hoping to do is increase the longevity. So there's lots of materials that are good for comfort, things like foam and rubber, but they're porous. And one of the pieces of feedback that we got from the hospital was they have to be able to be sterilized, and rubber and foam don't fit that criteria. We started with an N95 shield, and we gave those out to typically nurses who were wearing them during their shift, and the feedback was really positive. And then we shifted our focus to the face shield because that was what was being recommended as kind of a standard gear. It's comprised of 2 parts. There's the actual face shield, which is about 12 inches square. And then there's the band head assembly that goes together, including a latching mechanism with different sizes. So it's about 45 seconds to cut a face shield, and it's about a minute to a minute and a half to cut the band. One of our first designs, we were going to have the medical staff assemble them, but we want to give them as least to do as possible. And if we assemble them, it's easier. Just for testing, we put it in straight bleach for 30 minutes and rinsed it underwater for 2 seconds, and it was completely odorless. So also alcohol, Lysol, anything like that won't affect it. The material that we ordered comes in a 4x8 sheet, and from there we cut it down to fit inside the bed of our laser. And then we run 2 different jobs. One of them is 2 face shields side by side, and then the second one is 4 bands. So we kind of run X amount of one job and then half the amount of the other. And then we're actually using rivets to assemble them together. And we found that guarantees that they're just not going to come apart. One of the things that we realized is when we had a large pallet delivered of this PETG material in 4 foot by 8 foot chunks, cutting it up was going to be a problem. Normally we process things on a table saw, but that just causes this material to shatter. Our machinist said that we should check out a company just down the road from us on Laval called Western Roofing. And I drove over with a sample of the face shield and walked in the front door. They don't know me, I've never been in there before, and I explained what we were doing. And I said, is this something you would be able to cut up using your shear? Because they cut roofing tin and things like that. And the guy said, well, I'm not sure, but let me chuck it in. And he stopped what he was doing, threw it in his shear, cut 3 pieces and said, yeah, it looks like it works. We offered to pay because, obviously we don't want to interrupt their work. But as soon as we told them that we were doing this for a donation and not accepting money for it, we dropped off the entire pallet and they processed the entire thing for us to our specifications for length and said, don't worry about it. The hospital does have, fairly rigid requirements for PPE gear, and rightfully so. But again, because there's none to be had and there's such a need, they were willing to look at designs being provided. So we made 6 of them and delivered them to the hospital and had them evaluate them through that. Then they did actually give us approval to continue manufacturing these and bringing them in through an official channel. The main goal in all of this is to get as much PPE to the hospital and to other frontline workers as possible. And so once we got approval for the hospital and a design that they said was adequate under the circumstances, we ordered more material. So we should be able to manufacture about 8,000 masks. Now, in order for that to scale in a timely manner, we are going to be looking for outside help from the community, people with industrial lasers, people with 3D printers, people with other manufacturing capacities that can help us process that amount of material. Our hope would be that everyone would do what they can. Not everyone has manufacturing capacity, but they may have other things that they can do to, help, frontline workers or just the general public, in dealing with this crisis, and hopefully it'll pass soon.
I'm telling you, their face shields are by far the best device that we have seen. They're comfortable. They are absolutely perfectly designed to be able to prevent anybody from sneezing or having direct contact. We need them because we're checking the temperature of our residents. We're wanting to ensure that our employees know what their temperatures are, and we have basically handheld thermometers that can basically identify what a person's temperature is. We need to have these face shields to be able to be in proximity with our clients and with our staff. Literally, we were like kids in a candy store up at our office on Friday afternoon, looking at these things, realizing just that comfort of feeling safe. So, from our leadership of Ask Wellness Society, one of the largest nonprofit organizations working with a very compromised population, we are incredibly grateful to their generosity, their ingenuity, and frankly their tenacity to just keep reinventing this and redesigning it to make it effective. It is quite a compliment to the entrepreneurial endeavors that happen in this community, and I think Scorpion Industries deserves to be recognized for their willingness to support people that are working with the vulnerable in this community.
That an organization who is also affected at times like this would want to do something and reach out to healthcare workers in the community. It's fabulous. And these face shields are a huge issue and support for us. And also from the financial point of view, obviously like many organizations, both businesses and charities, we've had a lot of our funding streams cut off. And so this is huge for us. What I would like to say to Scorpion is from our staff, from our patients, from our families, because it protects everybody, just a thank you from the bottom of our hearts.
If you are a frontline healthcare worker and you're not with one of the companies that we've already discussed, or you would like support from us, you would like some of these shields, we're super happy for you to reach out to us, contact us. Probably the easiest way is the phone number. And you'll probably speak to Eden when you phone. Our phone number is 250-377-4399. We're super happy to help. We're looking for people to help. And we would love to get masks into your organization as soon as possible.